A good afternoon to all of you. Were you all eagerly waiting for it? Wednesday it is, isn't it? Just the days, the time, everything goes so quickly whenever we are coming in front of you. So what are the things that Neetu's Academy has in stores for you? We have an array of exam training that we give. If you feel that you need a professional touch, do not hesitate. We're always there for you. But if not, we are also coming there in front of you with all these free classes that is there for you to grab. I come on a daily basis from Monday to Friday with reading. Anita Madam comes with her self-prepared writing depiction case note. Then we have our colleagues coming in your way with n number of things you want to talk about. You asked for listening, we gave listening. You asked for speaking, we're there with speaking. You wanted reading to be more, we have supplied you more. We have grammar challenges coming your way. Every single thing that we are trying to do is to make sure that you all are benefited. So happy to see Shine Johnson, good afternoon. Nashpati Mall, good afternoon. Christina Rose, good afternoon. A very, very, very good afternoon to all of you. So as you know, I am Vinod James and welcome to Neetu's Academy Reading Live. Hope you're all doing good. Yes, fair enough. So you can see that our April, May, June batch have started. Okay, that's another information. And also you can see on the screen that we have a lot of different exams that we give training. And if you are really aspiring to go for one particular country, see for example, let's say you want to migrate to Canada. Okay, there are few new exams that is very much stipulated for migration and work purpose to go to Canada. It's of course a non-academic exam. That means it doesn't mean that it's not going to talk about, because it is going to give you the contents which are not academic. That's all. Okay, so which is more onto a daily real life scenario kind of things. Okay, so Rekha Vinayar, good afternoon. Arun Ravi, good evening. Savit Biju, good afternoon. Sharat Chandran, good afternoon. Next, see, we have been doing ever since we started 2024. Every day we've been giving you a lot of insights on the aspect how to deal with 8 minutes, how to get 20 out of 20, how to get 400 and above. And as I'm always, more energetic every day after the exam results gets published. Yesterday also we have n number of students who have made to their dream, and it's so nice to see their happy faces. That's what we always look for in Neetu's Academy, as we believe that we are all our family. When you crossed over that line, that makes us feel so proud about you all. Understood? So yesterday also we had 2 people coming and saying, yes, I made to my dream. And on top of that, we have a lot of different scenarios where you have to always make sure that all of you are getting over that line. So in order to make sure that all of you are getting the benefit out of it, one thing which I keep on emphasizing is, one, do practice on a regular basis. Okay, see, please do. It doesn't matter whichever or wherever you are attending, whatever that you're saying, make sure that you are attending and doing on a daily basis. I missed few good afternoons, I'm very sorry. Susan Sunny, good afternoon. Rasna, good afternoon. Josh C, good afternoon. Atira Sally, good afternoon. Neetu Unnikrishnan, good afternoon. Hridya, good afternoon. A new name for me, but yeah. Joyce Thomas, good afternoon. Josmi Joseph, good afternoon. Lydia Varghese, good afternoon. So if you want to get more insight, get on a regular basis, whatever that we have been doing, we have just been the official social media platforms that Neetu's Academy are there. So if you have not yet joined, please do not hesitate to join. We'll be happy to assist, and you would definitely be benefited, because we always try to make sure that you're not going into a fraudulent people's hand. We try to stipulate a lot of things, but of course, We have our own limitations because these people come with all different way because their job is to cheat someone. So when somebody contacts you like that, the only thing that you have to always remember is you have to be smart enough. Just report them and block them. Straight, I'm telling you. If anybody contacts you, even at the very same page that you're watching, just ignore. Report them. Okay? Because we will never contact you. We will never ask you to do any such thing. That's why we always come right in front of you. Angasudha, good afternoon. Jijimon, Dolvin Archana, good afternoon. Meetu Srinath, good afternoon. Mahi Sudhar, good afternoon. Kavita Balaji, good afternoon. Few new names for me. If there is anybody who's attending the live for the very first time, please do let me know that you're attending for the first time and also where you're from, because I would love to know where you are from. Not for any other reason, because I want to add on to my known people's collection. Maria Chinnavattini, good afternoon. So anybody ആരെങ്കിലും ഉണ്ടോ ആദ്യമായിട്ട് ലൈവ് അറ്റൻഡ് ചെയ്യുന്നേ? Ashley Jose, good afternoon. Asha Mohan, good afternoon. Nice. But nobody have told me that you're attending for the very first time, so I always think that you have been there. Zamrin Zera, good afternoon. Again a new name. Shiny VS, good afternoon. Sophia Thomas, good afternoon. I would love to see at least one icon next to you, because that shows the number of, not the number, the abundance of support that you give for us. Kalei, Maldives, good afternoon. Nice to see you again. Sophia Thomas, yes sir. Okay, fair enough. Good. Happy to see. Jijimon, okay, very nice. I'm for the first time from Dubai. Okay, thank you very much. So why I keep on asking is, you should know that all the students who keep on sharing the link, supporting us, they should always feel that their shares, their support, their thing are not gone waste. Why? Because there are n number of students, like what Digimon said, first time from Dubai. Now I have Sophia who's saying I'm from first time from not yet, is it? Right. Josie Thomas, first time from 𝐴𝐻. Okay, nice. Fucker Suffer. Okay, fair enough. A new name again. Lydia Paul, hi. Josie, first time from Oman. Very nice. Sidhu from Bangalore. Sanal, good afternoon. Hridya, first time. See, the number of first timers. This is all because you all have been tremendously supporting all of us. Okay, that's an absolute honor to come and say, because of you all there. Sophia from Saudi. So you can see the diversity of the class, isn't it? Why I asked is because for all of you to know that you are all attending a class which is international. What else could you ask for, isn't it? Being a trainer, I should have, or we say, you have to be very proud to say you're taking an international class, isn't it? Your people from, if you want to know where our students are from, as you can see, there are students from different parts of India, Nepal, we have people from Sri Lanka, Mauritius, Maldives, Malta, different parts of Middle East. We have people from Pakistan, we have people from Afghanistan, we have people from Israel, different parts of Africa, we have people from Australia, New Zealand, South Africa, Ireland, Scotland, UK, Canada, Italy, America, you name the place. We have people from all these places, and it's such a nice thing to do as well. Mahi Sundaram from Tamil Nadu. See, where are you from in Tamil Nadu, Mahi? Because we have people from Chennai, we have people from Tirunelveli, Marthandam, Kanyakumari, Coimbatore, Erode, Salem. So all these places we always have. So good. Hridya, where are you from? So if you can, see, it's not mandatory that you have to tell, but if it is okay, yeah, please do. Because I would love to know where you're from. Steffi, good afternoon. Anuan, good afternoon. Akila Sham, good afternoon. So a very, very, very good morning and a very good afternoon and a very good evening to all my lovely students. Okay. Mahi Kanyakumari was just there a few months before. If you would have told me before, I would have come and met you. Hridya Trishur, Kerala. Okay, fair enough. Good, good. Reha, good afternoon. Right. So nice to see a mix of known people, new people, and also renowned people whom I know. Okay, fair enough, fair enough. So are you all ready for today's session? As again, I would like to emphasize, today I'm not going to talk about any 8 minutes or 20 out of 20 or 400, because in order to get you into that, the first and the foremost thing is to show a consistency. Consistency with regards to your attendance on the daily basis of practicing, not for anybody else. Okay, it is for you to start telling, see, did I do yesterday? Yes, I did. Am I going to do today? Yes, I'm going to do today. Am I going to do tomorrow? Yes, I'm going to do. It can be material. It can be the smallest gesture of doing a habit. You take something that you like to read. Please do read. All right. So today, come what may, 8 minutes barrier, 20 out of 20, 400. The only one thing that you have to start is to have habits. Habits means something that you do on a daily basis. All right. 𝐻𝐶𝐵H, good afternoon. 𝐿𝐿 𝐿𝐿𝐿 ready. 𝐿𝐿𝐿 ready. Reha ready. Kavita Balaji ready. All right. So as I mentioned about the importance of doing on a daily basis, now because you are all ready, I'm not going to keep you waiting. The first thing we'll be talking about a part B. Okay, the material will be coming up on the screen, and do not waste your valid time. See, please always have a focus saying that the material that I'm going to do can be the material as I do on the day of exam. Just do, there you have the material. Please do the material and then we will discuss. Okay, time I've just exhausted, you see. Anju, good afternoon. So I hope all of you have an answer on or before that you have finished your time, is it? I'm sure that you're all excellent students. You've been doing to the level best there. Shiny is saying, I have done. Fair enough. Kalei is saying, done. Good enough, good enough. Just small is saying, done. Good, good, good. Sidhu is saying, done. Thangasudha, done. Shine Johnson, done. Ashwati Mol Prakash, done. Christina Rose, done. Nitu Krishnan, done. Good enough. Rekha Vinaya, done. Ashley Joes, done. Kavita, done. Okay, fair enough. Now, because all of you have said done, I would want you to tell me, what is your answer? Not just what is your answer, where you got that answer from. That where is the most important thing in order for me to assist you. If it is right, happy. If it is not right, we are here to correct you. So do not worry. Lydia Varghese done, 𝐾𝐓 done, Digimon done. Okay, good enough. Right. So would you be kind enough to tell me what is your answer and where you got that answer from? And in the meantime, see, I don't know whether you have seen, yesterday we have posted all these gorgeous faces who have made to their dream. If you haven't seen them, you should go and watch them. See, you should go and see them. See, I will also have my picture there one day, making your dream a reality. And you should see the scores that they have achieved. Absolutely stunning scores. And writing, they have scored stunning. So Kale is the first one to tell me I got C from middle part of the para. Okay, fair enough. Now the first answer is I got C. Fair enough. Reshma is also seconding it, saying that C from middle. 𝐿𝐴𝐵𝐵𝐺 done. So what are your answers? Shoot. Josie is saying C middle para. Sophia done. Okay, good enough. Ashwati Mol is saying A from last para. Okay. Thanga Sudha is saying B last para. Rekha Vinayak is saying C. Reha Vasipin is saying C. So generally the weightage is for C. But although I have A and B as an answer as well. Anita Simon is saying A, Shine C, Savit Biju is saying A last para. So A from last para, C from middle para, B from last para. See how it is from the very same place that you are, assessing different answers. Fair enough. Kavita Balaji is saying C, middle. Now what are the important things that you have to really look for or be cautious? See, when Akila Sham is saying A, so what you have to always remember is when you're doing part A, the first and the foremost important thing that you have to do is, Monica Vegas, good afternoon. I hope your exam went very well. Yes, I'm sure you would have done excellently. Don't worry, God has a plan and He will surprise you on the day of exam with making sure that you are crossing the barrier and you reach your dream destination. Jilmi is saying A last para. Lydia Varghese is saying A last para. Jijimon is saying C. Sidhu is saying A. Okay, fair enough. Now you have a mix of A, B, C. Claudine, good afternoon. Nino Vincent is saying A last para. Okay, fair enough. Now let's go and see how or what the answers can be. Okay, the material will be popping up on the screen. So what are the things that you have to be very cautious? Sophia from Oman, no? Right. So when the material pops up, the first and the foremost important thing that you have to do when you're doing reading, part B, is, see, read the question. As you read the question, underline the keywords in the question, understand the question. Okay. So what are you to do? Read the question. So what is the question saying? What does this information on injection technique tell us about the lifted skin technique? So information about injection. So you are very much sure about it, isn't it? This is something that you do on a daily basis or regular basis. Most of you, I wouldn't say all. Okay. Athira, good afternoon. Rasna A, okay, fair enough. Now, what are the things that you have to really look into? See, you have to read along with the question, understand the question, and then only you'll be able to see. Now, see, these are the things that you have to be very cautious about. See, when I was looking into it, it's too late. For what? No way. There is nothing too late. Don't worry. Okay. See, these are the very common terminology which you're not supposed to really be cautious about. Okay. Now, see, that is very common, isn't it? So don't worry about underlining those and all. Okay. Allows for a suitable needle choice. So allows needle choice. Those are my keywords. Now, ensures medication administered into the muscle layer. So ensures administered muscle or medication administered muscle. That is also even ensure not needed. Involves releasing skin quickly, reduce risk of bruising. Okay. Now one are saying it gives you an option to select the size of the needle, The other one is medication is administered into the muscle layer, and the final one is when you release it quickly, you don't have any bruising. Now let's see infection technique. Okay. Now, as the amount of subcutaneous fat varies between patient, individual patient assessment is vital before carrying out the procedure. So you need to assess individually. Okay, fair enough. Nothing to with the given three options. It is important to avoid inadvertently injecting the drug into muscle. So they are saying it is not possible that you inject the drug into the muscle. So ensures medication to administer to the muscle layer can be eliminated. So B is eliminated. Okay, I'm not saying from there only, but for me it is not right. Into the muscle, as intramuscular injection can affect drug absorption. For example, inadvertent administration of insulin into the muscle can lead to accelerated insulin absorption, lead to hypoglycemia. It can cause trouble. Okay, so ensures medication to the muscle layer is not going to be beneficial. So for me, B is eliminated. But the question is injection technique versus lifted skin technique. Okay, a lifted skin technique, pinching or bunching the skin, can be used to lift the subcutaneous layer away from the underlying muscle. So you're going to take it away from the underlying muscles. Now what do? This method reduces the risk of inadvertently intramuscular injection when undertaken correctly. However, now comes, these kind of keywords are very, very, very important. Cohesive markers, yeah. Releasing the skin too quickly before the injection is completed or lifting incorrectly can increase that risk. What risk? Can be subcutaneously underlying to the muscles. Okay. So involves releasing to reduce the risk of bruising. Not sure. Okay. So for me, this is also not the answer. Okay. Now needles need to be long enough to inject the drug into the subcutaneous tissue. They come in length of 5 cm, 6 cm, and 8 cm. It is suggested that the required needle length can be estimated by pinching the skin and using the lift technology, selecting a needle that is 1.5 times the width of the skin fold. So for me, the answer is A. The lifted skin allows a suitable needle. Why? It is clearly saying that only. Because the elimination is the most important thing when you do in part B. Lift skin, it's to ensure the medication is administered into the muscle layer? No. Lifted skin involves releasing the skin quickly to reduce the risk of bruising? Not at all. So the answer is A. For people who have got A, absolutely good enough. People who have got B, do not worry, you've been corrected. Understood? See, understand the question. Okay, Reha? Good enough. Prasna is dancing. Sidhu is saying I'm right. Anita is happy. Tanga Sudha clear. Fair enough. Jismol is dancing. Good enough, good enough. Do make the most out of your, when you get something right, do enjoy. Kavita clear. Fair enough. So if there is any doubt, please do clarify. If not, we'll go to yesterday's part A, because there was a small technical glitch, isn't it? So very sorry for that inconvenience again. Kalei, sad, no need. Okay, Akila, dancing, good enough. Ashwati Mol, happy. Sophia, yes, you got it right. Fair enough. Tansy, clear. Good enough. So because you all have got it cleared, let's go to the next one, because I've already shared it. So the part A is supraventricular tachycardia. Nice name, isn't it? Supraventricular tachycardia. Fair enough, Shiny is happy. Good. Now, would you be kind enough to tell me how you felt about today's material? And how many minutes, not today's material, yesterday's material, how many minutes did you complete the part A? Please shoot your answers, and then we will look into, because I'm going to shoot the answers for part A, where you are going to tick, 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 and tell me how much of a total score that you have got. Fair enough. Easy, 12 minutes, Kalei, excellent, good enough. So the first review I have today is for both, all from Kalei, 12 minutes, fair enough, easy. Arun Ravi, as always, very precise, 14 minutes and 20 seconds, excellent. Reshma is saying easy material 11 minutes. Akila is saying easy material 11 minutes. Savit, you have been the one who has always hit that 8 minutes. Absolutely good enough. Keep it up, Savit. Easy 8 minutes. Excellent, excellent. Jilmi saying tricky 12 minutes. Okay. Fair enough. Right. So, what are the other things? Anju Nair is saying 15 minutes. Okay, fair enough. Right, because you're all there. Not all of you are saying. Okay, see, first and the foremost thing you have to always remember, what is the purpose? Am I attending this class to make sure that others are, like polished thing, or am I here with a purpose? What is my purpose? I'm here to learn. I'm here to make that difference in my life to make sure that I reach my dream destination. Jismol is saying 13 minutes but tricky. Okay, fair enough. So are you all ready for today's party? If so, give me a very quick thumbs up. Let me see how many of you are there eagerly responding to me. I know most of my students does, but I want all of you. So as soon as the material pops up, Sophia again, very precise, 15 minutes and 10 seconds. Good enough. Jismol is ready. All right, good enough. I can see if your thumbs are popping up now. Good. So the material will be coming up on the screen. Reshma is saying yes. So once the material pops up, Sidhu is saying yes. Neetu Nikrishnan 15 minutes. Okay, fair enough. Kavita Balaji is ready. Kalai ready. Okay, good enough. Right. Neetu Nikrishnan is ready. So the material is going to come your way. Then I'm going to talk about the strategy. Sidhu 12 minutes. Okay, fair enough. Right. So when the material comes, you have to always remember first and the foremost important thing in part A. See, in part A, you will only see the material just in front of you for 15 minutes. After that, they'll take away the material and then only they will present you with B and C. Okay, you always have to be very cautious with that. Monica ready, Rekha ready. Okay. Now, I'm just going to say there is some technical glitch on the aspect of material popping your way. So, as soon as the material hits, so I'm just going to talk about what are the important things that you have to really look into. Okay. See, the first and the foremost important thing that you always have to remember, okay, it is on the aspect of what is the strategy. See, the strategy for doing part A is called skimming and scanning. Okay. See, you have to always remember skimming and scanning is the most appropriate method that you do. So what are you going to do? You're going to do skimming and scanning. Okay. Now, what is skimming and scanning? What's the difference between skimming and scanning? Skimming means quick look. Scanning means detailed look. Okay. You have 15 minutes only where you are expected to tackle 20 questions. Clear? Now, how much time can you take for skimming? They say 1 to 2 minutes, but I would say take only 15 seconds per text because you have 4 texts based on one common theme. Okay, these are the fundamental things and you have to underline the keywords. I'm just going to give you a quick insight about what can be the keywords. Keywords are headings, subheadings, letters given in bold letters, italics, numbers, abbreviation, bullet form. If it's a pictorial representation, your X and Y axis heading and all those things. Now, how to do skimming? Skimming means you're going to quick read it. Don't read word by word and all, okay? You're going to quick read it. As you read, you're going to underline the keywords and go. Okay, I'm just going to show you. See, when your heart rhythm isn't normal and the speed of the heartbeat isn't right, it is arrhythmia and different names of kind of arrhythmias depending on where it happens. And that got tachycardia, beating too fast and 100 times more resting while SVT, supraventricular tachycardia. The faster rate begins in the upper chamber. The causes the problem is electrical signal and circuitry in the heart which beats too fast and again between the mind making the enough blood supply. There are 3 different types of premature, paroxysmal, action. So done. So what I know, this is called this. It beats, the heartbeat is too quick. Then you have 3 types. This is what it is. Likewise, you have to go through each text. So here they are talking about risk factors. So any question with regards to risk factors about SVT, go to B. Likewise, you should know text C is talking about a study. Text D is talking about carotid sinus massage, vaginal maneuvers, cardioversion, catheter ablations, and all those things. Now, go to questions. So as I mentioned, 20 questions are divided into 3 types as what your SVT is. Okay, so these 3 types, the number of questions, the instruction all should be by-hearted. So 1 to 7, these type of questions are called match the following question, where your instruction clearly says you are supposed to write letter A, B, C, D, and you may use any of these letters more than once. Clear? Now, if your skimming is proper, mark my words, your answer to part A is just a piece of cake. It's purely keyword reference because it is synonyms which is being used. Now see, varieties of SVT. So where are they talking about varieties? Types, isn't it? 3 types are there. Done. I'm not going to bother looking into it. So which is the typical duration of narrow QRS tachycardia? So where are they talking about tachycardia QRS? It should be there somewhere in the study, isn't it? So QRS tachycardia. There, that is it. That is enough for you. So the answer is C. Management method only to be performed exclusively by healthcare professionals. So who was only to do? So where are they talking about all these treatment and all those things? Is there anywhere mentioned? Yes, never try it on your own. That means only experienced professional. Then the answer is D. Ailment that elevate the risk of developing supraventricular tachycardia. So condition that enhances this or gives you the more possibilities of doing or getting that. So where are they talking about? Definitely in risk factors, isn't it? So what are the conditions? There are n number of conditions mentioned, isn't it? So where? Conditions are mentioned in B. So I'm not going to worry about it. B. Adverse effects of rapid heartbeat. So something which is having a negative outcome. So what is the negative outcome of heartbeat? When your heart is beating too fast, your heart can't fill blood between the beats, making it hard to get enough blood to your body. So that is the problem. So the problem is mentioned in A. Medication that can heighten the likelihood of supraventricular tachycardia. So some medication that can enhance, again, should be under risk factor. So what are the risk factors? Where are the medications, including asthma medication, cold and allergy? Done. B. Understood? So what procedural event transpires during the catheter ablation? So where are they talking about catheter ablation? I'm not going to worry about it. Why? It is there in D only. There is no other place where catheter ablation is mentioned. Understood how you have to really look for? Now, question number, next set. So the next set of questions are called short answer question, where the instruction clearly says the answer can be a word, can be a short phrase, anything between 2 to 3 words. It can be words or numbers or both. Sidhu 7, Reshma 7, Akila 7, absolutely good enough, keep it up. Okay, so Kalai 7, very good. So now see, all these things you are not going to change anything, isn't it? See, you have to always remember this is how we are getting better. Arun Ravi 7, good enough. Now see, Christina 7, excellent, lot of people with 7, very, very good, keep it up. So what should be examined? So when the arterial rate is not higher than the ventricular rate. So something to compare, arterial rate versus ventricular rate. So where do you think it should be? There somewhere in the thing, isn't it? So are they saying anything about articular weight, ventricular weight and all those things? Yes or no? They are saying arterial rate then greater than ventricular rate. Yes, no. So what should be analyzed if the arterial rate is not greater than ventricular? So something to compare. So what are they saying? Not higher. So that means if it is higher, yes. If it is not higher, analyze RP interval. RP interval. RP because in the text it is given as capital, but just try to replicate it. Yeah. Now, what therapeutic approach suggests the undertaking of specific action to alleviate supraventricular tachycardia? Alleviate, lessen, relieve. Okay. Now, where do you think this can be? So, definitely under some treatment, isn't it? Vagal maneuvers. So, these are the things that can alleviate. Why? Relieve. So, are they talking about it? Yes, it is. So, all these things is to relieve. So, 𝐉𝐴GAL Excellent. Good enough. Clear enough and is high. Besides medication for cold and allergy, specific medication that prevent a risk factor for SVT, present, sorry. So we have already done that, isn't it? Cold, allergy, asthma is what I remember from text B. Certain medication, including asthma medication, can be a risk factor for asthma. So see, this is why it is important that when you don't find an answer, skip that. You will find it from the other places when you go through, okay? What is administered to the heart through a set of paddles or patches to restore normal heartbeat? So something to do normal. What are they saying? It should be under. It should be it's in D for all those reasons. Why? It would be there talking about D. So what are they saying? So they are saying, in an emergency, the doctor can place a set of paddles and patches on your chest to deliver an electric shock. So 𝐿ECTRIC and with or without an is okay. Misuse of what particular drugs is considered to be triggering factor for SCT? So some drug is triggering factor. Drugs. So where are they talking? Risk factor, is it? Yes or no? It can be, cannot be. Yes. So drug misuse is cocaine and methamphetamine. So COCAINE and METHAMPHETAMINE. A cardiac condition that is confirmed if the RP is shorter than 70 milliseconds. So 70 milliseconds go where? So no longer than 70, shorter than 70. So our question is what? Shorter than 70. So the answer is AVNRT. What does acronym PSVT represent in the context of cardiac health? So PSVT, where are they talking about? PSVT, it is there, isn't it? PSVT is paroxysmal supraventricular tachycardia. So PAROXYSMALSUPRAVENTRICULARTACHYCARDIA. Now for the final set of questions, these are called fill in the blanks questions where your instruction clearly says a word, short phrase, numbers, very similar to short answer question, but here redundancy. Okay. So overindulging in dash and dash can elevate, increase the risk of developing SVT. So something, again risk factor, so something to do. What are they saying? A lot of caffeine and drinking too much alcohol. So caffeine, CAFFEINEALCOHOL. Coughing or breath holding can calm the dash, a lengthy pathway from the lower brain through the neck to the stomach and regulating heart rate. So something which is there, again go to D. So something to do with what? It is the, sometimes certain actions can relieve SVT, coughing, holding breath, putting ice pack, all these things can calm your vagus nerve. VAGUSNERVE. Now question 18. Question 18 is saying, in dash, thin tubes threaded through veins releases heart cold pulses to eliminate the abnormal electric pathway causing SVT. So what is that? in who? I missed 17, is it? I'm sorry. I'll come to 17. So let's deal with question number 18 and then go to. So in catheter ablation, tiny tubes, vein, all those things. So this answer is catheter ablation. CATHETER-ABLATION. So I missed question 17. So being dash, reaching middle age, entering the older demographic can elevate one's risk of SVT. So who was at risk? So somebody with risk, isn't it? So risk factors, who is the person who is going to get the risk of? When you are pregnant. So being pregnant. So pregnant. Question 19. The absence of visible dash in regular tachycardia serves confirmation for the condition known as ANVRT. So ANVRT, where are they talking about? Definitely there are places where only one place, ANVRT. Correct? Now which one is going to cause? That's the next question. Okay? So the answer is which one? Which one? Tell me. See, you have to always look into the keywords. Okay. Then see the visible P waves gives you ANPRT. So why? Because no. So straight into ANPRT. So P waves is the answer. The ultimate question for today. Faster heartbeat may impede, okay, the heart's ability to fill with between beats, affecting the efficient circulation. So somewhere it is affected, isn't it? Who has been affected? That's the next question. So let's see. Are they saying somewhere when your heart is beating too fast, your heart can't fill blood between beats? So what is it? So it is impeding what? Blood. BLOOD. All right. So I have completed my 20 answers. Now, if you have any doubts with regards to any of those answers, you're always welcome to talk to me, clarify your doubts. If not, do shoot what are your total scores. Reshma 19 out of 20, absolutely good enough, excellent, keep it up, keep it up. Shine Johnson 18, very, very good, keep it up. How about others? Jilmi 20, stunning Jilmi, very, very good, keep it up. Sabit 18, excellent, good enough, good enough. Kalei 18, keep on dancing, why not? Nancy 18, good enough, keep it up. Any Sidhu 17, good enough, keep it up. Akila Sham 20 out of 20, excellent, keep it up, keep it up. Jismo 17, good enough, keep it up. Very nice. So most of you have got great scores. Anita Simon 19 out of 20 and improving. Very good. Happy to hear that you're improving. Good, good, good. Arun Ravi 16. Good enough, good enough. Shine Johnson, thank you. So Shine has already started saying thank you. So because I don't see any doubts coming your way from you, so I think all of you are very clear with whatever I have told you. So until and unless, I would take the opportunity to say thank you so much for giving another lovely session. Until and unless I see you all tomorrow.